Dr. Beck, you're an MD and you are on top of it. Have more and special training with nerves and muscles, and thus you can do tests and stuff which literally the average MD can and will not do. Now, tell me a little bit. We have certain, when people have neck pain, when people have shoulder pain, when people have lower back pain, when they have arthritis, when they have other muscle problems, like a sports injury, whatever it may be, a personal injury with a whiplash or something like that. People kind of go, well, where do I go? Go to a medical doctor, go to a surgeon. They usually go to a medical doctor, might send them to a surgeon, go to a chiropractor, go to a physical therapist. How do you fit this together? Because it looks to me like you're really doing a little bit of all of it. You kind of like seem to be fitting it together, but I'm not so sure. Why don't you explain it to us?
Well, that's a great question, and people really, there's a lot of different resources for them to treat neck and back pain and conditions such as that. I guess my prejudice is to start with a medical doctor to have a good checkup, because the concern is that people could have an underlying medical illness that only a medical doctor could find that could be mimicking more of a nerve or muscle issue. So that's sort of my prejudice, to start with a good medical examination and physical examination with a medical doctor. Now, there's a variety of ways.
Is that something you would be doing already, yes or no? I mean, you are a medical doctor.
Yeah, this is the kind of thing I do, is I initially see a patient and evaluate them for other medical conditions to make sure it's not just a simple strain or sprain of the neck or back or a simple case of sciatica, and it's not something a little bit more serious or severe.
Okay. Well, it looks to me a lower back pain or sciatica is pretty severe, but
it can be. What we're trying to make sure, though, is that you don't have a cancer lurking around somewhere in there, or infection in your disc or in your spinal bones. Those are serious conditions that require much different treatment than most people would expect.
Okay, but what about the MD who, at the same token, might not look for the pinched nerve because that's too low for him, or that's just not what he's trained on. He's not trained to look for some of that synergy in the muscles or in the bones and in the alignment of the whole body. And very few MDs prescribe exercise, and if they do, they say exercise. Exercise what? You understand? I know that you need to have very specific exercise for very specific muscle movements. A certain dancer, if you want to be a ballroom dancer or Argentina tango dancer, you need to be knowing which muscles to move to be correct. Skiing, some similar muscles, but some very different muscles again. And if you don't have an expert there who tells you which muscle to use and tells you what exercise to do to move that muscle, you're lost. So an MD wouldn't bother with that very much. Okay, you start with an MD. Now go and carry us through. What's the next step?
So we start with, again, a good physical examination, history, testing to make sure there's not a serious medical condition, like I said, like a cancer or an infection that's causing your problem. And then, as they say, there's a lot of ways to skin a cat. There's a lot of ways to treat neck and back pain, and I try to use a variety of techniques to come up with one good result from a patient. Now, like I said, as a physical medicine rehab specialist, we specialize in therapeutic exercise. This is our bag, the thing that we do the best, and so we will frequently use targeted exercises. Either directed by myself. I frequently use physical therapy to help me when we need a more intensive type program. And so therapeutic exercise is a big thing. And I can prescribe medications to help you as well. If you need anti-inflammatories, occasionally people do need steroids to help with the inflammation. Pain medications for short-term relief of your pain are sort of the type of things that we do. Now, a lot of people also ask about chiropractic, and there is quite a bit of overlap. It's not we all do the same thing, but we do sort of the same thing, and we overlap somewhat in services. And I frequently work with chiropractors. They do some things I don't do, such as adjustments. Their philosophy is a little different, and they look at things from a spinal alignment problem rather than necessarily a sports medicine approach that I take. And they still get good results. Now, they also do exercises and things of that nature. Physical therapy sometimes will do manipulation like a chiropractor does. And some MDs, particularly osteopathic physicians that are in physical medicine and rehabilitation, will also do manipulation. So we all sort of touch on the problem from slightly different angles. I don't know if you've ever heard the story about the three blind men and the elephants. You know, one man has the trunk. He says the elephant feels it must be a snake. One has the leg, you know, and it feels like a tree. So we're all sort of grabbing the elephant from different angles here, and we don't necessarily all have the whole picture. And so this is why I like to work in a comprehensive fashion with a team of people to come up with the best result for my patients.
And to a very high degree, that team of people is right in your practice already, correct?
That's right.
And one of the things which, at least in the last few minutes you didn't mention is, so the MD, yes, he can eliminate or find real systemic problems such as certain cancer, blood problems or whatever. Then there is the very specific things you are doing, which is tests for nerves and muscles. This is easier. Okay. Sorry. So we to make sure that those muscles and nerves are flowing correctly. And then there are the treatments, including medicine and exercise and physical therapy and adjustments, and basically putting the whole picture together. So so basically what it is coming to your practice is you don't go to a carpenter asking for shelves because he'll make wooden shelves. Not that that's a bad thing, but if you go to a guy who is working with, let's say, steel and metal like I used to in my first profession, I will weld something together, and somebody else may weave a shelf together. And while they're all very good, needed, you want to go to somebody who can 100% say, for your condition, in your climate, in your whatever, here's what you need, because he has them all. He doesn't need to be prejudiced. And that's apparently what your clinic is all about. An MD, and yet you put that, what maybe the rest of the world calls alternative treatment, in it as well, so you have it both in your case.
In many cases we do that, yes.
Well, thank you very much, Dr. Beck. Bye-bye.
Okay, thank you.